last year, maybe a year and a half ago, we started engaging ourselves with Vietnam. And that's through an organization called Interplast. They asked me to be the first medical educator to the #1 children's hospital in Vietnam, which is the premier children's hospital. They asked me to go there primarily to teach pediatric hand surgery and also burn surgery. Vietnam is a different country than what we see on TV 30 to 40 years ago. When I first went there, I have no idea what I'm going to see because I still remember some of the pictures from the Vietnam War and all the problems that Vietnam faces, except that this visit show a vibrant country. People want to make a better life for themselves. People want to contribute to the economy. Everybody's moving at a very fast pace, and most of the population are under 25 years old. So the younger population really do not remember what happened during the Vietnam War. Interplast is an organization that was started primarily by a plastic surgeon who wanted to take care of children with facial deformities, such as cleft lip and palate. And now this organization has grown into many different countries with emphasis on children's health in India, in Africa, in Southeast Asia, and also more recently in China. Children are important to all of us. The parents, they would travel 3 or 4 hours without much means to come and see us, primarily for us to take care of the children. As a medical educator, my role is to teach. So unlike big medical missions where they take supplies, a lot of anesthesiologists, surgeons go to underserved facility and do a lot of operations, my goal is to go there to teach particular surgical procedure, teach them how to evaluate patients, and how to take care of patients after surgery. We select a few cases, do it in an unhurried way every day, and do the operations. And sometimes when the child presents with bilateral hand problems, then I will do one side and watch them do the other side, and so they can learn from me and also for me to check to make sure they're doing correctly on the other side. And that kind of interactive approach is very useful. University of Michigan is a global institution, and for us to be engaged in our 3 missions, it's very important for us to leverage our global presence to teach, to bring the infrastructure and medical care in this country to the standard that we think are acceptable, and also patient care to take care of the patients in those countries, not directly, but perhaps educate the next generation of physicians and surgeons to take care of the country in a level that we think are acceptable. The contribution is really small if you look at the whole scale of the world, but if all of us doing it, one child at a time, I think eventually we will make a big difference.